This is an audiovisual representation of a study published in the Journal of Bone and Joint Surgery in 2023. The use of neuraxial anesthesia during total joint arthroplasty, or TJA, of the knee or hip increases the risk of developing postoperative urinary retention, or POR, characterized by impaired bladder emptying despite a full bladder. POR can increase a patient's risk of urinary tract infections, or UTIs, and bladder injury, with the added burden of delayed discharge post-surgery. Foley catheters are used intraoperatively to drain urine and prevent POR. However, the use of long-term indwelling urinary catheters is also associated with patient discomfort and an increased risk of UTIs. To this end, a research team from Chicago hypothesized that a short-term Foley catheter, inserted in the operating room and removed 2 to 3 hours post-surgery, would not only prevent POR, but also minimize the risk of UTIs and promote early ambulation in patients undergoing TJAs with neuraxial anesthesia. The team conducted a single-center randomized controlled trial in 388 patients undergoing TJAs of the knee or hip with neuraxial anesthesia to test their hypothesis. Of these, 194 patients received a short-term Foley catheter in the operating room, while the other half did not receive a catheter. In this study, POR was defined as requiring 2 or more straight catheterizations postoperatively or placement of an indwelling urinary catheter postoperatively when indicated by retention of at least 450 milliliters of urine on bladder scans. When comparing patient outcomes, the team found that 4 patients from the Foley group and 5 patients from the control group developed POR, suggesting no significant differences in the rates of POR between both groups. They found a significantly lower incidence of POR among female patients. Moreover, 10 patients from the Foley group and 14 from the control group required at least 1 straight catheterization postoperatively, although this difference was not statistically significant. There were 4 patients that developed a UTI, all of whom received a Foley catheter. However, the difference in UTI rates between treatment groups was not statistically significant. In summary, short-term Foley catheterization does not decrease the rate of POR in patients undergoing TJAs of the hip or the knee with neuraxial anesthesia.